take an individual and
In English.
Okay, y'all grab that.
Oh, we're doing that.
Those notes I just gave you.
In English.
And we'll go over these. Sorry, I don't have kids' PowerPoint.
She walked by the door and then put her finger to the window because I'm in there alone. No one's in there.
Also, 8th graders, don't forget if you have your picture envelopes, make sure you bring your
Sometimes.
picture envelope with you.
Yeah.
Okay, I am recording today.
Oh, man.
Not online classes.
Like, what school do you online?
Schools.
Like,
Campbell, Commerce, Wolf City,
Commerce doesn't have a
Oh,
health
B.
science class.
Health Science.
I figured they would.
Okay, so let's look safety in the workplace. So this will start a new unit for us. We'll talk about this actually today, Thursday, Friday. I'll have a video lecture over fire safety. And Alan actually does have a PowerPoint, so it'll be a little bit more entertaining. And then next week we'll actually talk about safety for us, like picking up patients, moving them to chairs, moving them back to bed. So we'll move Wilma around. And each other. I'll let you guys transfer each other too. So that way, if somebody needs you to help them do that, whenever you go to the hospital or somewhere, you know what to do. So we'll learn how to do that. You'll have a skills check over that. We'll learn about range of motion. And anyways, so safety, when we talk about safety, that's generally the #1 priority anywhere you work, not only for the patients, but also for you. And so that's what OSHA, you talking about the OSHA research, the assignment that you guys will have. OSHA, you might know what that stands for.
Occupational and Safety Act of 1970.
Well, that was the law that put it into place, yes.
Good reader.
Where's the H come from?
That's why it's not.
Yeah, I noticed that halfway through.
It's going to be objective,
It is occupational.
occupational, subjective
Safety.
house association.
Occupational Safety and Health Administration.
That makes sense.
So, OSHA's purpose, and we'll get there in anyways, but that is safety of the worker. It also includes safety of anybody serviced in an area. But typically OSHA, you usually have to do OSHA training in any job that you have, any job, anywhere. It's just a safety training for the people, for the employees. So anytime you guys get to whatever job you get to, you'll have to read about OSHA and whatever their requirements. If you guys have ever, sometimes you'll see, like in a restroom door at a restaurant, there on the back, it'll have sometimes you'll see OSHA stuff written in there, or like washing hands, that kind of stuff, things safety related.
And it says safety and health.
Administration. I say that now that I say it out loud, it sounds fun. Okay, so the meaning of safety, it says is freedom from danger, risk, or injury. Why do you think risks is included in there? Yeah. Well,
Just in case you have a lot of risk in your workplace.
yeah, there are some jobs that are high-risk jobs, right?
Or could somebody open the scalp falls on your foot?
Sure. I would say surgeon's probably not a high-risk job. I mean, liability-wise, yes, but safety-wise, I mean, it could be. You could do that, yes. But that's not like,
Football is risky.
yeah,
Yeah.
football, definitely.
Monsters come at you all day, every day.
Welding, any kind of, think of window washers.
Have you seen the
Yeah.
pictures where like the window washers dressed up like Spider-Man and Batman and Superman for like children's hospital?
What are some other high-risk jobs? Working offshore on an oil rig, I would think would be a higher risk job. Any kind of traffic, anything that, even construction, construction.
Construction, especially when it's all.
Or working on roads, you think about working on
Shut down
roads.
people driving.
Disasters,
Yeah, police officers.
police.
More than that.
So
No.
the thing is, there are some jobs that carry more risk than others, and healthcare, there are plenty of risks. One of the major risks, especially nursing wise, is back injuries. Because you think about it, some of your patients weigh, may weigh 3 times more than you do. And so there is a high risk of back injury in healthcare.
But-
Is he not?
Sorry, Siggles.
But
No.
Anyway.
Shut up.
I mean, you think there are some, it can get really difficult. Now, there's specific ways. I'm going to teach you guys how to save your backs. But that's something that's really important. It sounds silly, you think, because you can cheat, it's like you always want to use your legs instead of like bending at the waist. But it's really easy to cheat and just bend at the waist because that's easier than using your legs. But the thing is, it may not hurt you that very moment, but 10 years from now, it could. So, this is for both of you. This now. Body and Zach. So,
It's you and me.
okay, it says, meaning of safety. It says an attitude or way of reacting towards hazardous or unsafe conditions that will protect both the healthcare provider and the client or resident, so it includes both. It says an attitude or a way of reacting. So, and that's really important. Why do you think why does it say attitude?
Because if you have a bad attitude, everybody's going to hate you for the day.
Regarding safety. They may hate you for the day.
Like the surgeon may throw a scalpel at you. Okay.
Why do you think it says the word attitude?
Because if you're not in the game, then you're more likely to mess up.
Okay,
If you're not
that's really
concentrating.
good. Yeah. Focus, if you're not paying attention to what you're doing, if I go to move a patient, I have to think, okay, I really need to use my legs. I don't want to bend over to move them because that puts strain on my back that I don't need to put on my back. It is an attitude. It's just like a constant being aware of safety things that are going on around you. This was a big thing, especially when I did home health, because people's homes are a lot more hazardous than like the hospital as far as just their home in general. You go, like if I would go in and I'm doing my assessment, I'm thinking, okay, this giant rug here is like turned up, so that's a risk for them falling. Or I go in and I've been into some hoarders' homes doing home health. And so you go in and literally like the walkway to get wherever they need to get in the house is like this wide. And you go in, and follow it around to wherever their bed is, that's the fall risk and just not generally very safe or sanitary, I guess. Been to people's homes where literally, it was like if you sit for too long, you get like roaches in your bag and pockets and stuff. It's pretty, there's people who live that way. And so, they're just, I don't know, constantly, those were things I was looking for. Because I was trained to look for those. I had an attitude of, I have to look for the safety hazards in this home. Is this a safe place for them to be? What do I need to know on my assessment that exists? Because if they have things that are making them at risk for fall, that's something I have to teach on. I had to teach on, let's move this rug to a different area, or let's make this walkway, wider so that you can get your walker through here and you can actually use your walker, those kind of things. Same thing with the bathtub. That was something, as soon as I went in for a home health assessment, that was something I always had to go look at, was their bathroom. Do they have grab bars that they can hang on to while they're in there? Is the floor really slippery? will their walker fit in there? Is there room for a seat so that I can order them a seat to put in there? Those are the kind of things, constantly, you just have to have an attitude of, what's safest. Any unsafe practice should be reported immediately. And anytime in clinicals, whenever we get to clinicals, if there's something you guys are worried about or concerned about, let me know. If it's something immediate, like for example, I had a student one year who was walking by up at the nursing home, and she noticed something didn't look right about the lady in the room. And I don't even remember what made her think that. Anyway, she told the nurse, and the nurse goes in, and the lady's bed had, I don't know if it had fallen all the way back or somebody had laid her too far back, and she was always supposed to be at like 30 or 45 degrees sitting up because she had a risk of aspirating, which is just like fluid getting down into her lungs. And so, anyway, so they had the suctioner, and she was in there for that whole thing. I don't know what would have happened to the lady if she hadn't told the nurse. So if you ever see anything that's out, don't be scared to say something, or just ask, if you see something, why doesn't this lady have this? Or what about this guy? Like, explain, will you tell me why this? And you don't want to come off as like a know-it-all or anything, but, if you go in with an attitude that says, I want to learn, they're going to want to teach you things and explain things. And sometimes that can bring to their attention something that might be out of whack. Does that make sense? So, and that wasn't anybody necessarily, who knows maybe a family member went in and she said she wanted to lay down, who knows what the situation was there. But as far as play has no place in a healthcare setting, definitely. And that will definitely go for clinicals. It's just not a place to mess around, because it's just like that. That seems simple. You go into a room, the lady says, I really want to lay down. You lay her head down. It's not supposed to be down, and she aspirates and gets pneumonia. That's a simple thing. A lady falls and you try to help her up and break her arm because she's got serious osteoporosis. Those are things that are risks, but, and that's why I want you guys to make sure if something like that happens, get help. Don't just, if somebody falls, you're not going to help them up by yourself anyway, but go get some help to do that, just because you don't know what their background is, their situation is, or even if they can hold themselves up at all. So, causes of accident, poor judgment. Big one. Not recognizing the danger in a situation. So not realizing that there is a risk. That's really important that you train. That's one of the things that you'll do when you're in school or you're doing your certification or prep work, whatever you're doing, is they train you to see the risk in things. And I find myself constantly, like when I think about my kids, I have to really kind of rein myself in, because I would get a little crazy with the safety stuff. Sometimes I'm like, gotta let it fall sometimes and whatever. So, but poor judgment is a big one. Just making bad decisions. Physical limitations. So the lack of ability to avoid or prevent an accident. So not realizing that, okay, I'm not able to move this 300-pound person by myself. Okay. Knowing what your limits are. And that's a big one. It's always better to get help than to not get help and get injured and then not be able to work. Lack of training, so not being trained on how to do things. Some environments are hazardous, so the environment itself and recognizing those, and then not knowing the person or identifying the wrong person. Medication errors are a big issue in healthcare. And you'll hear whenever you guys get to school, whatever you do, any of the things that you do, nursing, occupational therapy, paramedic, radiology, whatever, medication errors are high on the safety priority list. And that's because they happen. I I don't want to say commonly happen, but they happen more regular than what you think they probably should. And there's all kinds of reasons for that. Somebody calculates the wrong dose. You got too many, hands in the pickle jar. So pharmacists and there's so many people involved. You don't read the instructions correctly. I mean, there's all kinds of ways to make medication errors. Somebody mixes it wrong. Oh, look at the wrong patient. If you've got 5 patients, it's not hard to go into the room, assume, get your patients mixed up. They change all the time. That's why they always check your wristband 8,000 times, it seems like. And like when I was in the hospital, Baylor, and I don't know if they do that over here, they had like a scanner that they would have to scan everything. They scan the medication, they scan my name, and scan, I think, their name in order to make sure that it was going to the right place. It's like checks. Plus, you spend so much of your time, especially nursing-wise, you spend so much of your time just preventing errors. Now, look, the videos that we're going to watch in a little bit, they say that you can prevent 100% of accidents. Now, not saying that they won't happen, but they're saying that they are preventable. They're 100% preventable. Not necessarily saying that you're never going to make a mistake or anything like that, but they're saying that they are, all of them are preventable. Which potentially is true at some level, somewhere along the way, everything is preventable. Just because let's say I give a patient a medicine and it's labeled correctly and they have a major reaction to it, well, I couldn't prevent that, but maybe the pharmacist who mixed it wrong could have prevented it. Does that make sense? It's not necessarily saying that one person can always prevent it.
Question.
We'll watch them in a minute.
If something like that happens, who take the fault? Right?
It just depends probably on the situation, but really it's everybody takes that fault. It's just the way it is. I'll give you one example. I gave, and this was a medication there, I don't think it was my fault, but I still had to write up the report about the incident report. I was working at Children's and came on shift. The nurse who I was taking over for was really behind. I just got busy in the afternoon. She was really behind. So this first patient, I go in the room and her medication has already been sitting for an hour or so, been ready to give. They just haven't made it in there to give it. And it was ready, mixed, ready to go, labeled and everything. She also needed a pregnancy test run, which is pretty standard. Any girl over the age of 12, if they have to have anything done to their abdomen, CAT scan, anything like that, they always do a pregnancy test. So not anything abnormal to run. And I don't know when they had done her last assessment. But anyways, they were really behind. And the medication was, I don't remember the time, it's been so long. I don't remember the time limit we had to give a medication once it arrived. But there was a time limit and it had passed. So for me, my priority was to give her the medicine. That was already late. So I go in, do my assessment, give her the medicine, and then I was like, I'll go run the pregnancy test, after I get all that done. So I go run the pregnancy test, and it's positive. Well, I come back, and the intern had been in to talk to the family, and they already had an idea that she was pregnant. Well, I didn't know that. Nobody communicated that. It wasn't in the notes. It wasn't anywhere. Well, that medication, it wasn't something that was going to be bad for the baby, but it wasn't something that was good for the baby either. It was pregnancy category C, which basically means they haven't tested it enough to know either way. Which may not have been given. I don't know if the doctor would have given it or not had they known that she was pregnant. One, she wouldn't have even stayed at Children's had we known that. We would have taken her over to Parkland. And so one, that was major miscommunication. Two, the nurse before me didn't communicate that to me and didn't give the medication when she was supposed to. But then I'm the one who did give the medication, so I'm the one who ended up with the fault of the mistake. And I don't even know that that's really considered an error per se. I treated it as one and wrote up my form and talked to my supervisor and all that. So, I mean, things happen, and you feel like, in my mind, I guess I could have prevented if I asked her if she knew she was pregnant, but that wasn't a standard question that I asked in the emergency room at Children's, for every girl who walked in the room. So, in my mind, that's not really something I could have prevented, but it could have been prevented, if that makes sense, if communication had been better and so forth. Does that make sense? So, yeah, those things happen, and sometimes it ends up being your fault, even though it doesn't really feel like it's your fault. That's just the way it is, because it's a team game. Everything you do, you work with other people. That's the only time I can think of I've ever had to fill out anything. OSHA, like I said, it's safety in the workplace. So a lot of people have to do OSHA training. I think they do OSHA training if you're in a welding class. Yeah, I think you have to do OSHA training thing, but anyway. Okay, client care safety. So bed safety. It says keep bed at a working height. Now, this bed is not so easy to change, but because it has a crank and you have to crank it up. I'll show you all in a minute. And then you have to crank it back down, so that's really kind of annoying. But that's how they used to do it. So now you just hit the arrow. So it's really important, if I'm going to go in and do something, like if I'm going to do wound care, put in a catheter or whatever, I raise the bed up to a level where I'm not having to stoop over for 20 minutes longer. Does that make sense?
Teachers, pardon this interruption at this time. I need all seniors to report to the cafeteria for pictures. Seniors, don't forget to bring your picture envelopes. All seniors, please report to the cafeteria at this time.
Okay, where was I? Keep bed at a working height. It says when leaving a room or getting client out of bed, lower the bed to the lowest level. Why would you want to do that?
So if they fall off the bed, it's not that high.
If they fall, they're not going to fall from the highest. Definitely, always. You don't ever leave them at the highest position, even though you put them there.
Students, at this time, I need all juniors to please report to the cafeteria for pictures.
That's leprosy.
Okay, we're at bed cranks. Most places don't have bed cranks anymore, but this one does, and you guys can see up here at the very end, down there on the end where Jacob is, there's a crank, and if you leave it sticking out, it would be really easy for people to trip on. But most of the places you guys go, they're going to have electric beds. You're not actually going to have to. People might have that in their home though. Children's environment should be adjusted depending on the child's age and developmental ability. We studied that when we did child development. Different, kids are at different levels, and be able to adjust for that. Lock wheels on the bed. All of that will always lock, and some of them are kind of fancy the way that they lock, and the pedals and stuff. But anyway, just because you don't want them falling out, they try to get out of bed, and the bed moves behind them. You don't want them falling. Wash hands before and after carrying. We know that. Side rails on the bed are viewed as a restraint. Now, when I was in nursing school, you always left the side rails up for everybody all the time. But you really just have to go by whatever the policy says or whatever the patient's orders are. Wheelchair safety, you always want to push them from behind. Forward wise is what it's saying, except for going in and out of elevators. They're talking about pulling in, because you don't want to put them in, I don't know, you have to pull one way or the other. Or down curves or ramps, you generally go backwards. If you're going down, you want to go backwards, because if you go forwards, I'm telling you this from experience, I almost lost control of my grandma one time. I just turned down a ramp, so don't do that. You gotta turn around backwards and go.
At least it's your grandma, not like some stranger.
She was fell out on her face.
So.
And then you ran over.
Sorry, Granny.
So, yeah, make sure you do that. Fasten on safety straps to secure them. No, you think that's funny, but I'm just telling you.
You're my least
Yeah,
favorite.
no, that wouldn't have been too funny. Bit like
It's kind of
there.
scary.
I
I was
was
like,
thinking about it.
I tried to totally act calm, like I was totally in control, but by the time we got to the end of the ramp, I was like, praise the Lord, I didn't just throw her out of this chair. But I played it off really well. I acted like-
Wee!
Don't let their laptops drag on the floor. They're generally covered up, and you don't want that dragging on the floor because we all know there's nasty stuff on the floor, especially at a hospital or a nursing home. Set brakes when the chair is still, so if they stand up, it doesn't fly out behind them. Park chair in a safe place, out of the way where other people could trip and fall. Pad the chair to prevent pressure and skin breakdown. We'll talk about that a little more later on, but we've all talked about skin breakdown. Y'all heard me talk about that before, right? Pressure ulcers, bed sores, or if you lay in one position for too long, any bony areas that because of that pressure that's on the skin and the underlying tissue doesn't get good oxygen flow.
I have a
So
question.
a lot of the places where you tend to get bed sores or pressure ulcers is the tailbone is one spot. The bottom, both hip bones, people get them there. Ankles, toes, elbows. I mean, I had a patient one time, she was so sensitive to that because she'd been in bed for a long time. Even her toes, if you left the covers on her toes, the top of her toes would start breaking down. So her husband built this like little frame to go like out of PVC pipe to put over her feet so that they could put the blanket over that.
Good husband.
He was a really good husband because this lady was in bad shape and he nursed her for a long time. What were you gonna ask?
Isn't that like just flesh rotting? You know, that's what
It turns into that, Chris.
Okay.
But it just breaks down it because there's no oxygen and all of your cells have to have oxygen. So when they don't have that, they start to die. Yeah, this lady, particular lady I'm thinking of, she had one on her hip, and I literally could put a Q-tip in this far. That's how far I had to
A
put it.
Q-tip.
Like one of those long, that has the wooden end
Swabs
on it.
things?
Yeah, that's what I'd use to pack it with. Yeah, we washed it out with like a bleach type solution, bacon solution. It's going to be mixed. It's like part water, part bleach.
Do they hurt the
What was
person?
she?
She, yes, I mean, I know it was uncomfortable because sometimes she would move, but she wasn't verbal enough, or I don't know if she had dementia, really severe dementia. I don't really know if she was even with it enough to put pain, skin-wise with pain in the brain, if that makes sense.
Like, do they hurt the person?
Who?
The patient. Like the bed
The
sores?
bed sores, yeah, they can. It just kind of depends. A lot of times, if they get to that point, their nerves are so shot that it's not necessarily like a severe pain, but it can be. I mean, it just depends on the person. And you see some big ones. I mean, sometimes they'll be like, you can see bone and stuff down in them too, and they can get really bad.
I think I've got to take my mind.
It's a lot easier to prevent than it is to treat. Because that lady, we did wound care on her for, I don't know, a year, probably, same wound. So much easier to prevent by keeping them turned and off of those pressure places every 2 hours than it is to try to fix it. And a lot of times in wheelchairs, you can get actually wheelchair pads that are like shaped and conform to them. Like you can go to a place, they actually like take a mold of your bottom, basically, that fits in the chair, and then they make a pad that's shaped just for you. That helps to prevent
Sure,
breakdowns.
it's money though.
Lots of money, yeah. Wash hands before and after, we already know that. Stretcher or gurney safety, always make sure that if you're going to move somebody in a bed, either the side rails are up or they're strapped down. Obviously, if it's like a gurney, like a gurney you see on an ambulance, you want to be strapped down so they don't have sides. So
Wait, what's the journey?
it's like a
Rolling
gurney.
bed.
Yeah, it's like a
Oh,
rolling.
just stretch it.
Same thing. Same thing.
So what's like the board that you carry?
Let's call it that. Sounds pretty much out loud. Okay, stand and push at the client's head. That's where you're going to push them from, so they're going the right direction. Unless again you're going down a ramp and then you'll back them down. Never move a stretcher at a fast pace. There's moments where you would probably need to do that, but right. Never leave a client unattended. What that means on a stretcher. That doesn't mean ever. Obviously, you're going to leave them unattended at some point. That means on a stretcher that doesn't have sides and everything. Set brakes on anything that's parked, and then wash hands again before and after. We'll talk about restraints when we come back Thursday. We'll just start here because I want to show you guys the different types of restraints. So, stop there. I'm going to show you guys these videos.